to stretch. You have to. If you have knee pain, your workout's longer.
Right.
You know, that's kind of the take home of it.
Yeah, that's probably the best thing out of this is that, like, if you're in pain, your workouts are automatically 20 minutes longer than what it is for the work. And for us to just ignore that fact when we really don't have anywhere to go, like, now's the time to kind of take care of it, you know?
Yeah, and see that works.
Right.
You know what I mean? So once you see that it works, you'll do it more when you don't have the time. When you don't have the time, because you do.
Right.
We all did. A lot of times you just never. So I think now is.
All right, guys. Welcome to, I don't know what this is called, but people have been texting me. One in particular, and I know she has an issue, but I know a lot of you guys don't have a resource, or you can't get to a physical therapist, or we don't know who to listen to. So I want to make sure that we offer you that, right? And we have our own Joe Bandy, works out at 6 a.m. With us at Krank. So he understands kind of like what we do. He also feels it. He also did today's workout, which is probably one of the longest workouts, surprisingly, that you will end up doing. Right?
You're getting me tired on this call. You're getting me beat up and tired on this call, but we'll get through it.
Perfect. All right, so that's what kind of we're going to try to do here. Joe has his own, company / physical therapy facility in his house. It's called Advanced Home Physical Therapy in Belleville.
Yep, you're right. You're right. Me and my wife is also a physical therapist, so we do go to, people's houses as well. So it's either in the convenience of your house or mine, either one. But it is Advanced Home Physical Therapy. Yeah, we've been physical therapists for 9 years now, me and my wife.
That's what we're going to do. So kind of open up like questions. If you have anything, you can always email me or text me, and we'll try to jump on these whenever we can. We want to keep them short, sweet, so we don't drag it out, because I know I can definitely drag stuff out. But this question is from one of the Kranksters, and it involves the knee. So if you guys have knee issues, I haven't been running. My knee bothers me going up and down the stairs, but not all the time. It's very strange, but lunges, squats, and anything like that is usually impossible to do without pain. The pain is kind of centralized. The pain seems isolated around the kneecap, the center of the kneecap, and kind of runs like a straight line up and down. Doesn't see any patterns, but also starting to feel some hip tightness, which might be related. Can you help?
Yeah. So, and we were talking about this a little bit before we started, but so just to break down the important things of what came out of that was, one, you feel it on stairs. Especially when I think it was stair descent, doing lunges, that type of thing. So what we're talking about is pain when you're lengthening the quad, which is an eccentric work of the muscle in the front. The other thing is you're also the symptoms of it being centralized around the kneecap and going straight line up and down. So that makes you think more of, just from where the pain is, it's more of a tendinitis thing, or a muscle issue and a tendon issue, rather than a joint line issue where you might feel it on the medial side, the inside of your knee, or the outside of your knee. And that can be when you're walking, when you're running. This is specifically when you're stretching the quad and making it do work, like you are when you're walking down steps or when you're doing a lunge. So, and the hip tightness actually goes hand in hand with that, because now you're talking about maybe that quad is too tight. You're talking about a tightness of your quad that's running all the way up to your hip. So now if you're starting to feel things at the hip level, again, that seems muscular. There can be other things. She didn't go too much into where the hip pain was, just kind of overall tightness. And that's what we're thinking of when you think of a patella tendonitis or a quad tendonitis, is that there's, between that hip flexor quad complex, there's a tightness, maybe a little insufficiency too, where it's not strong enough to do the type of work that you're asking it to do constantly, or giving it enough attention through, which I think is what we should probably go into more, is how to give that attention, right? So first of all, if you have this pain, the first thing that I would recommend, and again, so just to sum that whole thing up, again, I get lengthy too, is that it's probably more of a muscular issue, more of a tendinitis issue, involving your quad and that hip flexor complex. It's all one thing, right? Your hip flexor kind of runs into the quad, so tightness there can affect your knee. So the first thing that I would recommend is, when you have knee pain, your workouts are longer, period, because you need a longer warm up and you need to be doing things after it consistently. So I'm not big into a lunge hurts, don't ever do it, or don't ever walk down your stairs again. I think that's a little ridiculous.
Right.
But you need to, and Pete says this during the workouts, and I do this myself, is that if I do the 6 a.m. I still try to do that a little bit. Normally it's like 6:37 now, because why? But before I start the video, I'll do my own warm up, whether that's foam roll, whether that's, I do a lot of like line work that we used to do at Krank, where it's up and down, doing knee hugs, butt kicks, things like that. I do a longer workout before I get into Pete's video. So that might be 5 to 10 minutes there. And then afterwards, there's at least 5 to 10 minutes of kind of a stretch session where I'm down in the basement sweating my butt off anyway, and I don't want to go upstairs and hug my kids like that anyway. So I think that's the first thing you need to put into your head is, if I have knee pain, my workout's already 20 minutes longer because I'm doing more before, more after.
That's a really good way to look at it, because it's something that I don't even put out, because I do. Like, I did do my mobility, like my daily one. It's kind of what I do before I actually go into the warm-up that I film. You know, I'll do my stretching, my everything, you know, everything, full body. And
right, and you've said that. You have, and I do the same thing. And I think that everybody should, because, you know, they don't, especially if you're feeling those things. If you know your hip's tight, you should be warming up your hip a little bit more before you go into the workouts, because sometimes your warm up, you don't know where everybody's tight. That's not your job, is to, you know, your warm up gets us moving,
right.
And is kind of a global thing that maybe doesn't hit as much of that area as somebody needs.
Gotcha.
So if your hip's tight, so we can definitely do that real quick, is go into, so if your hip's tight, if your knees tight, let's go into what maybe a warm up beforehand would look like, and then what stretching would look like after.
What do you think we should do?
A lot of the line work is there. So a lot of the stuff that we did is there. I don't know if this person has a foam roll. I don't know how many people out there have one.
Right.
But going into real quick on the foam roller, when you do the foam roller, it should be a thing where you're when you go up and down on that foam roller, everybody knows how to do it, right? Everybody glides up and down on the muscle that you're trying to do. You're trying to loosen up. It's kind of like a release, right? So before, a foam roller is great before you get into exercise. I don't know how much it does to actually lengthen things, or it's, you know, but before you exercise, to make sure that that muscle is efficient,
right,
you want to release the tight spots. So if you're gliding up and down the side of your leg or your quad in the front, you should be finding those spots that are tight or feel like this is a pressure point, this is a sore spot, and sticking onto that point. So you've probably gone over that in Krank a little bit, but just to reiterate that point, to be effective, you have to stick that spot and give it like a 20-second stick. So you should be, when you're gliding up and down, that's not rolling your quad out. That's finding the spots, right? You're searching for those spots.
Right.
So when you hit those spots, you should stick them for 20 seconds. And that's, do it to your quad. Especially if you have knee pain, you should be doing it to everything, right? Quad, your hamstring in the back, the side of your leg. And when you do the side of your leg, everybody knows that as the IT band. You're thinking about the junction of that on both sides.
Gotcha.
So you're thinking about how that attaches to your quad in the front, and how that attaches to kind of the, again, quad in the back, but also the hamstring in the back. And you're trying to loosen that up off of those two muscles.
Gotcha.
Because if the IT band is bounded down to those muscles, that muscle's not working effectively. So that a lot of times goes a long way, just to hit the foam roller the right way before you're doing something, and that allows the quad to work a little bit more efficiently, and that might take care of a lot of the that kneecap pain that you're feeling when you're doing things that are lengthening the quad. Because if the quad can't lengthen and work because it's bound down to your IT band, or just bound down in general to itself because it's knotted up in a muscle because you never work on it, then yes, that's going to cause pain at the bony points, which is your kneecap, while you're doing these exercises. Am I going too fast?
So it's just pulling pretty much, right? Like the muscles are so like junked up it's actually pulling it more.
Yeah, so you're getting an abnormal pull too. So a lot of times the kneecap's going in directions because it's pulling out one way a little bit more than the other, depending on where your quad is tight, what part of your quad is tight. And it can be going off track.
Right.
It can be just a little bit too, and that's going to give you some of that sensation of pain. And you're going to feel the largest pull around the kneecap. So a lot of times hitting the foam roller the right way does go a long way in that it releases a lot of those tension points that don't allow your quad to work efficiently, especially during an eccentric movement where you're lengthening it.
Right.
So show that foam roller on the side too of when you like angling to get the junction. A lot of people just go over the IT band on the side. You should be angling the junction a little bit between your quad and your IT band. Okay. But so I'm seeing what you're seeing right now.
Yes.
All right. So, but just to, you know what I'm talking about, right? As far as, so if that side, it should always be a little bit turned. It shouldn't be straight here on the side where you're just, digging away at your IT band. That doesn't really do anything.
Right. That's a junction you're trying to hit, right?
Right. So you want the junction between your hamstring and your IT band, so you can kind of tilt out and then tilt forward a little bit. So it's always a little of that tilt, right?
Okay.
That's the only thing that I wanted to say with that. But
okay.
So let's say if it's, especially with quad lengthening, the good one is kind of, if I can show it, that when we talk about line work, it's kind of that grab and down. So that stretch as you walk. So I think that's a great one to show them. But anything that's going to warm up the hip a little bit more, in that, even knee hugs, the what do you call it when you go like pure form, the sits or the squat sits?
Yep.
Like figure four.
Yeah. Figure four.
So all of that stuff is maybe this person and anyone with knee pain should be hitting up every single time.
Gotcha.
Before they do it, you know what I mean? Before they turn on the video even. And that's what I do. So before I turn on the video, I'm on the foam roller. I'm doing line work up and down,
right?
Trying to loosen up, make sure my hips are loosened up, make sure I have no tender points in the quad or anything like that. They're going to make me less efficient.
Gotcha. Yeah. All right. That makes a lot of sense.
So, if you want to jump to kind of after, and I can sit here and think about any other warm up too, but for now we'll go to after. That's when that dynamic warm-up is good before, right?
Right.
Foam roller. Dynamic warm-up where you're going up and down. That's all what you should be doing before with the workout. Afterwards, like I said, when I'm sitting there in a sweat puddle is when I like to just sit and stretch. I think that's an important part that nobody does anymore.
Right.
And the other thing is, if you want to throw ice on right after your workout, even if it's not bothering you, or even if it only hurt me when I was doing lunges, so I'm not going to ice now because it doesn't hurt me now. Well, no, ice. There's some inflammation of the tendon there or of the joint line. Ice. Right. So that's where it can kind of get into lengthier times too. But afterwards, sit. I stretch everything, whether it's a straddle stretch, you're doing your hamstrings. You've shown, and if I don't even know if they watch like the Sunday mobility stuff that you show a lot, but a lot of the stretch, I think you put out one for the low back. That was actually, you did the kneeling hip flexor stretch. Right. The kneeling hip flexor stretch is great to loosen up the hip. Getting a quad stretch with that if they can off of that kneeling hip flexor, so you're getting a quad stretch in a hip extended position.
Gotcha.
Simple, your normal quad stretch where you're standing doing a quad stretch. How many, did we do this daily?
Right.
Stuff like that. So, but it's a lot of the normal things, butterfly stretch on the ground, but just actually doing it.
Right.
That's the thing. Or you're going to sit there and spend the extra 5 minutes after you just worked out and your kids are yelling.
Right.
Sit there and do the hamstring stretch, do the butterfly stretch to stretch your groin muscles. You know what I mean? Do the quad stretch, do the hip flexor stretch. You have to, if you have knee pain, your workout's longer.
Right.
That's kind of the take home of it.
Yeah. That's probably the best thing out of this is that, like, if you're in pain, your workouts are automatically 20 minutes longer than what it is for the work. And for us to just ignore that fact when we really don't have anywhere to go, like, now's the time to kind of take care of it,
Yeah. And see that works.
Right.
You know what I mean? So once you see that it works, you'll do it more when you don't have the time, because you do.
Right.
We all did. A lot of times you just never. So I think now is kind of the time, like you said, to really attack that and see that this works if I do the right things. And how can I modify that when the world gets back to normal?
Yeah.
To make sure that I continue to do it.
That's really good.